All right, everyone, we are live. Hello and welcome. David Kinder here, your host of Financial Advocacy Podcast with our co-hosts Mike Moffat and Kurt Gibbs. Today is Friday the 13th, which I was rudely reminded of this morning because you guys tried to play a little practical joke on me. And I'd remind you, I was born on Friday the 13th, which probably explains a lot.
Well, now everything is clear.
Yeah, we're all clear now, but gosh darn it. Anyway, we're not going there. And then here's the fun joke for this morning. My daughter tells my son that, she made a wise financial decision about $76 worth of ramen noodles. I didn't know that was possible. I thought I taught her a little bit better money management skills than that. Go figure. Anyway, but today is not about me. It's not about Kurt today. Let's talk a little bit about our industry. Is that most of us that are focused more on wealth management, the vast majority of us anyway, and we consider ourselves financial advisors and high net worth insurance agents and things like that. We normally don't get into health insurance much. Now, I've been health insurance. In fact, this past month, I celebrate 20 years as a licensed insurance agent. And I've always been health insurance licensed, but I think I've sold one health insurance policy in my entire career. And basically, I used the computer, checked the boxes, and did the things, and that's all I did. It was not giving health insurance advice of any kind. It's like, person had Cobra, showed them another plan, and that was it. And Kurt, I'll put you a little bit on the spot. Kurt, you don't even have a health insurance license, last I recall.
That's correct. I farmed that out.
You farm that out. We know what we're good at. We know what we're not so good at. And so, Mike, you know this stuff. You've built a good book of business on it. And I'm really glad that you can help bring clarity on this topic of Medicare and just giving us a consumer overview, which also means that I get to play guinea pig. And I'm going to ask you the questions that might sound stupid. I'm going to mix up some terminology because I am not an expert on all this stuff. If someone was to say, David, you got to enroll in Medicare, I'd be like, what? I would have almost no idea where to go. And I would want to turn to someone like Mike to say, just point me where to go. What do I need? How am I going to make decisions on this stuff? Because I have no clue. And quite frankly, in a way, I'm almost reluctant to learn about. I know enough about it because I'm in the insurance industry, of course. But that doesn't mean I know enough to advise a consumer. I know enough to be able to say, I know there's an alphabet of plans. That doesn't mean I know which plan's good for who. I know it's based on zip codes. There's so much that I vaguely know that it's important to get someone who really knows this stuff, who's actually been through the proper training. There's government training that's required on all this stuff. And we're doing this in a timely manner before, I think it's called open enrollment period. I think does that usually start on October 15th every year? I think that's about right.
Yep.
See, I got one. Okay. See, there's some things I know, but I don't know how to advise anybody on anything. So, Mike, I'm going to turn this over to you. Teach us, my friend, because we don't know anything.
All right. So we'll teach a little bit here. So just as a quick disclaimer, none of this stuff is endorsed by Medicare or the CMS. If you have any plan questions or any questions about anything specific in your area, reach out to a local license, contact agent, contact Medicare, 1-800-Medicare, do all that stuff. So this is not, there will be no plan specific information gone over in this presentation. So if you're looking for plan specifics on a Medicare supplement or Medicare Advantage plan, that will not be discussed. That's not really compliant to begin with. So we will be talking in generalities and giving overviews and stuff like that. So, and just trying to go over some basics. So don't, if you have questions, that's fine, but don't, ask things about, how one plan compares to another, because that's not the format for this and that's not really appropriate. So feel free to chime in. So a little bit of background on me. I got started in life and health insurance probably back around 2008, 2009. And I worked with the Aflac Duck for a while. And then once I got done with that, I moved on to working for a major risk and reinsurance company, which if you read my little about me section in my booklet that we're going to go over, you can find out who that is. And they're a global risk and reinsurance company, and I was hired on by them, and I sold Medicare plans to retirees of major companies that everybody knows of. I mean, these are, Fortune 500 and, 200 companies. So major company retirees, and they hired us to basically move their retirees from their group plan to their retirement plan. So I've worked with very large companies. I've trained hundreds of agents in Medicare and insurance licensing. So they actually sent me down to Houston to do all the training for them. So I haven't done as much Medicare recently because I've been more focused on the life side, but I'm very well versed in this, and it's something that I'm still passionate about, and that I like helping people, because I see a lot of scams out there and a lot of people doing stuff that they shouldn't be doing. So I just want to make sure, as we go into annual enrollment period, October 15th through December 7th, that we get some clarity and we can help some people out and at least bring the basics to the forefront here and clarify some things so that everybody understands how Medicare works, what's going on, what your options are, things like that. Again, no specific plan will be discussed, but we can give generalities. So if you want to pull up the thing that I sent you, David.
Okay.
So this is the booklet that I put together. If you like a copy of it, you can email me. I've tried to update some of this stuff as much as possible. There might be some 2024 information still in there. I haven't had time to go through and fix everything. So there's a little mix of 2024 and 2025, but we'll get it all squared away as the information comes out. So I don't know about you, but I can't. Okay, there you go. All right. So scroll on down, and then you can, this is just the cover page. You can scroll through that. It's just about me. You can read that if you want a copy of it. Okay, so Part A. So this also helps give me a format to talk about and keep me on track, because I can go off in so many different directions with this stuff. That's kind of the problem when you know more than you should, and you just kind of like put on rabbit holes. So
isn't that the point of this whole podcast anyway? We all can go down different rabbit holes of different little things, and bring on the rabbit holes, but don't lose my attention. Okay.
Yeah, so let's talk about Part A. So Part A is your generally referred to as your hospital insurance. Scroll down. So your Part A is going to help provide coverage for, you scroll up a little bit. So inpatient care in hospitals, skilled nursing facilities that are not long-term care facilities. So that would be like a respite type care, things like that. Hospice, home health care, and blood. So if you're
let's translate a little bit of that, because skilled nursing is all about skills that only nurses have been trained to provide, but long-term care is primarily about custodial care.
Correct.
And that is about the activities of daily living. And those are the things that just about anybody can help you with, but yet you might find yourself needing assistance with. So there's a definite distinction between skilled nursing care and custodial care, because the custodial care can be done by just about anybody who's healthy enough to help you.
Mm-hmm. Yep. Yeah. So exactly. Good.
See, I got one. Or that's two. I'm gonna count on this one. These things I get right.
Well, hopefully we can get you a few more. So,
okay.
Now, Medicare Part A, is most people, it's going to be premium free as long as you paid or your spouse have paid in the Medicare taxes for 40 quarters. That's 10 years or more. Otherwise, most people aren't aware of this. I mean, a lot of agents just go around talking about Medicare Part A being premium free, which is 99% probably of the time true. But there are some instances where people haven't paid their 40 quarters into Social Security taxes for Medicare. And, otherwise, your Part A premium would be either $278 or $505 a month, depending on how long you or your spouse have worked and paid into your Medicare taxes. So
it's a pro rata formula based on the number of quarters that, and people can verify that probably through their Social Security statements, I would believe, because they should be correlated one and the same.
Yep. Yeah. So you can always call and verify. Again, 99% of people aren't going to have this problem. Most people have been working for 10 years or more, and things like that. So the vast majority of people, this isn't going to affect, but I like to make people aware of it, that it is out there. And then again, generally speaking, you become eligible for Part A if you're 65 or older and you meet the citizenship and residency requirements, and you get disability, or you can also get disability or Social Security, Railroad Retirement Board benefits for at least 25 months. So you either have to be 65 or on disability, Social Security disability for at least 25 months before you can get Medicare Part A. Now, you can also get that from ALS or end-stage renal disease or Lou Gehrig's disease. So if you do have kidney failure or any of these other things that I have listed here, you can also get Medicare Part A. So those are just some basics of Part A. There's a lot more that we can go into and talk about as far as how that works. But I think that this is a good overview. And if you look at a lot of the brochures out there, that a lot of these insurance companies put out, a lot of them will just say Part A, hospital coverage. They don't give you any of these details. They're just, very, very basic, minimal things. So, and there's more that I could go into, but I just want to make sure that we're covering at least the basics and making, people aware of some things that a lot of other documents out there don't make people aware of. So let's go to Part B. And this is your medical or your doctor coverage, as a lot of people like to say. So Part B, now this is a key. It provides services for medically necessary. Let's, keep that word in mind. So if you have an elective procedure or something like that, Medicare is not going to cover it. These have to be medically necessary doctor services, outpatient care, home health care services, DME, durable medical equipment, mental health services, and other medical services. So Medicare Part B will also cover your preventative services as well. So those are like your flu shots and stuff like that. Your all of those typical things that would be considered a preventable.
So you mean the Botox treatments that I never get wouldn't be covered, right?
Not by Part B, no.
If I could get my psychiatrist to say that's medically necessary for mental health, otherwise I go nuts, would that work?
No, I don't think so.
Okay, just check.
But you can try.
we could try. There we go. Okay.
I mean, there's
I'm in Southern California. I mean, if some people don't get those kinds of things, they just might go nuts, and I might consider that a public service if they would.
It could be a mental health crisis. I mean, stranger things that happen, I guess. I wouldn't count on it, man. So, all right. So Medicare Part A, like we just talked about, is premium free for most people. However, Medicare Part B does have a monthly premium, and that is going to be based on your income. So typically, most people are going to pay for 2025 $185 a month, and that's up about $10 or so from 2024. So there has been a slight increase in the Part B premium that you'll see coming out of typically it comes out of your Social Security benefit check. So, right. So you are going to see a slight increase in that. And that's, about average, of an increase for Part B. So it's not too bad. So Part B will also have the same eligibility requirements as Part A. However, this is really important to know. If you don't sign up for Part B when you're first eligible, and you do not have any other creditable coverage, such as employer coverage, you may have to pay a late enrollment penalty for as long as you have Part B. And this premium may be up to 10% for each full 12-month period that you could have had Part B and you elected not to carry it. So again, just to verify and kind of recap, once you turn 65, if you don't have other creditable coverage and you do not make Medicare or CMS or Social Security aware of it, and you can't prove that you had other creditable coverage, you will have a 10%, up to 10% penalty for each full 12-month period that you could have had it, that you chose to go without it. So it is important to either enroll into it right away or to make sure that you do have some other creditable coverage. And then we can get into more about that and how, getting off of an employer plan works and stuff like that later. But a lot of people don't talk about this, and that is something that I do feel is important, that if you don't currently have coverage and you're turning 65, you should definitely make sure that you have Part A and Part B effective if you don't have other creditable coverage. I know, Kinder, you had some maybe some stuff about that the other day that when we were talking about this.
Oh, I can't remember it now. But
that's fine.
No, it's just making sure that, see, this is 10% each year, and this is a penalty for not enrolling.
Right.
As opposed to, and because keep in mind, my mind goes back to wealth building, retirement, and Social Security. Whereas if you delay claiming Social Security, your benefits increase by 8% per year until age 70. That sounds like an advantage, but you do not get the same advantage. In fact, you get a disincentive for not enrolling in Part B, and that's 10% penalty against you for each year that you do not enroll and you do not have other equivalent credible cover. Equivalent's probably not the right word, but the creditable coverage. We know that there's certain technical terms that has to be used in proper context. So okay.
Yeah, so the other important thing is that it is a permanent penalty. The 10% penalty does not go away. So as long as you have Part B and you're alive and you're over 65, that is a permanent penalty. There's no way to get rid of it. So it will always follow you. It'll just, I mean, honestly, 10% of $185 isn't a huge deal, but when you add it up and you think about it over time, and the premiums are only going to be increasing, right? So, I mean, having to pay an extra $20 a month for the rest of your life, it starts to add up. There's no reason to have to pay an extra, $240 a year for coverage when it could easily be avoided. So.
Yeah, and now what you said also right at the beginning of this, you did say it was based on your income. Now, we're going to cover that part at this point, or you want to wait until later till we cover that?
It's either way we can talk about it. I mean, generally speaking, I can look up what the highest Part B premium is. I don't have it in this brochure, but basically the higher your income, the more that you're going to be paying in Part B premiums. And so the other thing is that this affects a lot of people that end up selling a lot of stock or, their investments right before they retire, or moving assets or stuff like that. And they have a big income or a big taxable event, and they
sell their home and they relocate.
Right. And so they do a 2-year look back, I believe it is, on your tax return. So whatever your tax return was 2 years ago is what your part IRMAs, your Part B and Part D IRMAs will be adjusted to. So you may not see it hit right away, but you may see it in the next year or two, where you have a gigantic increase in your Part B or Part D prescription drug premium. So just keep in mind that can happen. Now, of course, if you don't show that kind of income, it will go back down, of course. But it does sneak up and surprise a lot of people that, like you said, sell a home or that sell a bunch of assets or whatever, and they show a large income for that year, taxable income. It does sneak up on a lot of people, and they don't realize that they have to pay this penalty. It's called a Part B or a Part D IRMA, and that stands for Income Related Monthly Adjustment Amount. So they're adjusting your monthly premium based on your income.
Yeah, it's one of those ripple effects that we don't always know based on certain transactions that we do. There's a ripple effect in other parts of the tax code that this could easily be overlooked, and it's annoying. And it can be challenged. There are forms where you can have it contested with I forgot who it is. I actually have it on my website. There's a couple of different forms to contest it to verify am I really subject to this or not. And so there's ways to go with that. But still, it's important to know that the higher your reported income, and even if it's capital gain income, it's still counted as income, even though it's taxed differently. It's still reported, and it has a ripple effect, including your Medicare premiums, Part B and Part D. Okay, I think we beat that part to death.
So let's talk about Medicare Advantage plans. So this is also known as Part C. So Medicare has Parts A, B, C, and D. So we're getting close to being done here, but Part C, or Medicare Advantage plan, is simply just another way to get your Medicare Part A and Part B coverage. So Medicare Advantage plans, like I said, are Medicare approved plans, and they are offered by private insurance companies. So, for example, Humana, Aetna, Blue Cross, United Healthcare, Cigna, all these private companies offer these different Medicare Advantage plans. And they're typically going to be network based, such as your typical HMO or PPO. So when you're going into these are very much like what you currently have now, where they have networks, they have co-pays, deductibles, max out-of-pockets, things like that. It's very similar to the plans that you currently have. So, of course, with an HMO, you're going to have to stay within your network for basic medical treatment, your preferred network, unless it's an emergency. In an emergency, then you can go anywhere. Now, I don't know. We were talking about some random off the cuff things that aren't really emergencies that people might think that they are, like yesterday. But I mean, it does have to be an actual medical emergency. You know, if you have a heart attack or a stroke, or you get in a car accident, or some, actual emergency, that is covered. Now, if you have a cold or a flu and you choose to go out to an out-of-network provider, that kind of stuff isn't going to be covered.
You mean my hangnail doesn't count?
I don't think so. It's not not a life-threatening emergency. No. So, yeah, but I mean, and that's, to be honest, that's the same thing in a PPO, right? I mean, even if you go out of your network with a PPO, you still have coverage, unlike with an HMO, but it's going to be at a much higher cost. So I feel like people get this almost false sense of security having a PPO, knowing that they can go out of network if they choose to, but yet whenever people go to the doctor, they said, well, who can I go to that's in my network? So, right. I mean, I guess, a lot of people poo-poo and hate HMOs and all this stuff. And, I see the pros and cons of both, but I just want to, bring a little bit more, balance to the force here, so to speak, and say, an HMO isn't necessarily this evil satanic thing that people make it out to be sometimes. Especially when, 99% of the time when you have a PPO, you're not using the out-of-network benefits anyway. So, and they do tend to be much more expensive and have higher co-pays and deductibles and out-of-pocket stuff. So, just some food for thought. I'm not necessarily recommending one over the other, but it is an interesting thing that I see, where a lot of people have this fear of an HMO that may or may not be really legitimate, but just kind of food for thought. So for an Advantage plan, you have to be entitled to Part A and enrolled in Part B. So, and you must also live in the plan's service area, geographic service area, like David was referring to earlier. Sometimes they go by county, sometimes they go by zip code, things like that. So it just depends. Each Advantage plan is going to be a little bit different in your area, so there's a lot of them out there, and there's just like anything else. There's good ones, there's okay ones, there's ones that I'm indifferent about. So it's just, you got to, and that's the advantage to this, is that you can shop them and find the one that, is going to be the most cost effective for you and your needs and your situation in your area.
So if we take one of the biggest names out there, I think of is Kaiser. Kaiser seems to be everywhere, but they're not necessarily everywhere. So you got to pick one that's going to be appropriate for you, and whether you like them or not. And people either love them or they hate them, and it just depends on which spectrum you fall into.
Yep,
that's the obvious one that comes to my mind anyway.
Well, and Kaiser again is an HMO. They only take their own plans, so they don't take other plans. In fact, they have their own separate Medicare Advantage program that you can enroll into. But yeah, Kaiser is a different thing, and that isn't in every state either. Now these plans will also include your prescription drug coverage. So it's included in the plan. You don't pay an additional premium for them. Now there are certain plans that they are allowed to leave the prescription drug coverage out of, and this would only be applicable maybe if you have other creditable prescription drug coverage, such as the VA. So if you have VA and you only plan on getting your meds from the VA, and that's the only place you ever go, you can choose to enroll in a Medicare Advantage plan without prescription drug coverage. I see the pros and cons to that also. Whether or not that you should do that. I mean, you're not being penalized for having the drug coverage with the plan. There's typically no extra premium for it. So the advantage that I can see to doing, to still having it is that if you're not able to get to the VA or whatever for a medication in an emergency situation, it still wouldn't necessarily be harmful to have the extra coverage just in case you need to go to a local pharmacy for an emergency situation to have a medication filled in that situation. But yeah, with VA coverage and other creditable coverage like that, you do not need to have prescription drug coverage with your Medicare Advantage plan. So they do actually offer Advantage plans that do not have prescription drug coverage attached. But again, 90 to 99% of the plans do, and most people get it. So it's just something to be aware of. Now, the other thing is the MOOP, what we call the MOOP, or the max out of pocket. So that is the limit that you'll need to pay out of pocket each year for coverage services. So let's say that, you have a $20 copay when you go to a specialist and a $5 copay when you go to the primary care doctor, and you have an ambulance in this, and all of the stuff adds up. And the most you could ever be out of pocket for medical services is that amount. So all plans are different. It could be, I've seen $2,000, I've seen $5,000, I've seen, everything in between. So again, that's where shopping the plan and making sure that the plan is competitive in your area is important as far as that's concerned. But yeah, so that is the maximum amount that you could ever go out of pocket in a plan year. So you would never, ever pay more than that amount, no matter how sick you were or how many treatments you had, or if you had a kidney transplant or whatever, I mean, that's the most you could ever be out of pocket. So now with a lot of these plans, they do offer non-emergency coverage out of your network. They can be at a typically higher cost, especially if it's a PPO, right? Like we talked about before, it is going to be typically at a higher cost. You're going to have a higher copay, a higher maybe max out of pocket, things like that. So now in many cases, you may need to get approval, which is also known as prior authorization, from your plan before it may cover certain drugs or services. So this applies in certain situations, and it can affect some people and not others. So it is important to be aware of any service that would need prior authorization, or any drugs in your drug formulary that you might require prior authorization for, and your agent can look at that for you before they enroll you in the plan. So that can be an issue that comes up. But typically, and here's the thing, is that all of these drug plans are required to cover a drug, at least one drug in each category class. So you can't, they can't just not cover like an insulin or something like that. They can't exclude drugs in a certain drug class. So, for example, most plans take these things, but let's just say, atorvastatin versus simvastatin, two pretty common, cholesterol drugs. One plan may cover one and not the other, but they're covering a cholesterol medication, and that's what they're required to do. They have to be required to cover a medication in that drug class. So I don't know of any plans that don't cover those things, but that's just an example. It generally tends to happen more in your more expensive drugs, where they're more specialty medications and things like that. That's generally where I tend to see it more often, where they'll cover one and not the other, and the person prefers one and not the other. But that applies to any prescription drug plan, not just a drug plan with a Medicare Advantage plan as well. So any Part D plan that you have, it will have a formulary. So it looks like you might have had something to say, Kinder.
I was looking at Kurt because Kurt just muted
Well,
himself. I thought he had something here.
I think I do. I think I do. And I'm, I know a little bit about what we're talking about here. Obviously, you run into your clients and they're going to ask questions about everything. But a question that comes to mind is just something you kind of touched on is, let's say you have, your doctor prescribes you this certain medication that for blood pressure, for instance, but it's not listed on the plan that he or she currently has. So they basically they have to pick and choose as far as which plan has that medication if they want that particular medication, or they just get their doctor to switch. Is that what normally happens?
Yes to both. I mean, they can also appeal to the plan to make a formulary, what's known as a formulary exception. And the doctor can the doctor could also write a note and say, Miss Peggy needs to take X drug because she's allergic to Y drug, and it does not work for her. So
there's somewhat of a workaround. I mean,
yeah, there is a workaround, a little bit of a gray area, but yeah. So if the plan doesn't cover that drug and you need it for a specific medical condition, they can write a note to the plan, and the plan can make a formulary exception for that. Something we didn't talk about yet is drug tiers. So they could maybe decide to put the medication in a different tier, a more expensive tier, and cover it. So they could do that. But yeah, so there are workarounds for it. But I mean, the simplest thing is to get a plan that covers your medications that you already take. Now, if you get prescribed a new medication, that's a different story, and there can be some workarounds for that. Again, if your plan doesn't cover it, you can have the pharmacy, or you can always talk to your doctor and see if there's an alternative that would work, that the plan would cover. But they do have to cover at least one drug in each category class. I'm trying to explain it that way. So you can't have a certain condition and a plan not cover at least one drug for that condition. So they can't do that. So they do have different formularies, though, and which ones they will cover for those different classes. And most of them are very, very similar, and they cover virtually all of your generics and things like that. Where the problem that more people run into is your specialty medications and your brand name meds. Some plans will treat brand name and specialty medications a little bit better than others. So that's really where the main issue lies.
Yeah, generics are always cheaper. And they're
right.
basically the exact same thing. But that's my opinion, and I'm not giving medical advice.
Yeah,
so.
I mean, I've talked to a lot of people about this, and there are people that have different opinions. Any medication that I take the generic for it personally. So I don't. There are some cases where I've heard of people saying that the generic literally did not work for them. And I think that's fairly rare and kind of one-off situations, but yeah. And again, if that's really the case, and you can your doctor writes a note and you can show proof that that's the case, then the plan will typically they have to include it, because you have to take medication to stay alive. So they can't make a formulary exception. So anyway, next part here. So perfect, part D. So scroll on down. All right, so part D is your drug coverage. D for drug. This is simple, right? So just keep that in mind. It is optional. You don't have to have prescription drug coverage, and it is offered to everyone with Medicare. Again, most of your Advantage plans will include your prescription drug coverage. So even if you, and the thing is, if you are currently, I hear a lot of people that don't take prescription drug medications, especially that enroll into a supplement plan, say, well, why should I purchase a prescription drug coverage? So here's the key, is that even if you're not taking prescription drugs now, you might still want to consider getting a prescription drug plan. And the reason is that if you decide not to get a plan when you're first eligible, so when you lose employer coverage or you turn 65, and you do not have any other creditable prescription drug coverage or get extra help, that's like Medicaid, you'll likely have a permanent late enrollment penalty if you were to join a plan later. And the penalty, again, is 10% of the national average premium, for whatever that's worth. That's a whole calculation, and usually Medicare figures that out. But there is a penalty. Again, it's for every month. I just want, not year like Part B, it's month. So for every month that you did not go without creditable coverage, this penalty will apply to you if you decide to get coverage later, because you do need to take medication and you do need a prescription drug plan. So there's a lot of really inexpensive prescription drug plans out there. They're not the most robust plans. They're not going to cover as well as other plans necessarily. But they still have pretty good coverage for, your generics and things like that, very low copays and things like that generally. So, paying, I don't know, $20, $25 a month, whatever the lowest prescription drug plan premium is in your area, just to have coverage to avoid this late enrollment penalty. And God forbid, in case you do have something happen where you need a prescription drug, at some point in the year, that makes sense to me. So I don't typically, recommend things per se, but in this case, I would say that it would be a good idea to at least have a prescription drug plan in case you need one, sooner or later, so that way you don't have to pay the penalty and you can actually enroll in one. So,
would it be fair to say that someone who thinks they don't need one probably hasn't seen a doctor in a long time, and that they really should go see a doctor?
Yeah, again, that's sometimes the case, and I did this for years and years, and I talked to thousands of people, and a lot of times the things that you'll see it more so, at least in my experience, is people that are more into like the homeopathic natural remedies, people that again have never been sick, things like that. They don't, I'll never take a prescription drug. Why do I have to pay for this? All of those types of things. Those are more the people that are upset about, this issue. But again, you never know what can happen. So why make it not an issue at all, especially if it's included with your Medicare Advantage plan, or, it's very inexpensive, typically if you get a supplement plan. So, I would just carry one, just even if I didn't take medication, just to have it in case I needed it. But that's my personal choice. I mean, if you really are against, some people are really against prescription medication, and, you say you'd rather die than take a prescription pill, well, then, that's up to you. That everybody can make their own choice. But I mean, for the vast majority of people, just pick up a Part D plan or have it included in your Advantage plan, you're good to go. But
some of those people, I'd probably have a disclaimer page say, okay, I would rather die than take a prescription. Please sign here for my records.
Right. I mean, have some kind of waiver form, right? So you don't get sued as the agent. I mean, that's just wild.
Yeah, but it wouldn't be the client that would sue. It'd be their beneficiaries. They're, whoever's going to inherit or whatever. Say, look, if you would have sold them this, they would have been around. They'd be around today. We're going to sue you. No, they make their own decisions. I could
even see the client suing you, saying that trying to say you didn't recommend it or whatever. So now you have all, so it could go both ways. But so 2 different ways we can get drug coverage. First is we enroll in a standalone drug plan. So that would just be enrolling in a plan through an insurance company, United Healthcare, Humana, whoever. And these plans will add prescription drug coverage to your original Medicare. So your original Medicare, right, that was the first 2 things we talked about, Part A and Part B. You can enroll into a Part D plan separately. And in fact, if you wanted to, and I don't normally recommend doing this, but you could just have Part A and Part B with a Part D, and not have any supplement or Advantage plan to go with it if you wanted to. But there's some loony people online that I've seen that advocate for only having A and B with a prescription plan, but that they're in their own little world, and let them just do whatever they want to do. So, yeah, I wouldn't want to be in that situation. You're really exposing yourself to a lot of risk. So, go for it, have at it. Now,
and what we're all about is making sure that people understand the choices that they have and the consequences of the choices of what they're considering at the time.
Yeah, I mean, as long as they're aware of what can happen, if that's what they want to do, hey man, sign here. Here's my waiver. So,
yeah.
I'm not responsible for your stupidity. But it is what it is.
That wasn't a moral judgment there at all, was it? Okay.
No. All right. So in order to get Part D, you must also have Part A and or Part B to join the standalone Medicare drug plan. So you don't need Part A and B. You just need one or the other. So you can have either one. The second way is with a Medicare Advantage plan that we've been talking about, and Medicare Part D drug coverage would come through the plan. So like I said, you have to have A and B to get an Advantage plan as well. So not all Medicare plans will offer prescription drug coverage, as I mentioned, but most do. And, your agent would be able to tell you whether the plan comes with prescription drug coverage or not. And it'll actually be in your plan outline, your summary of benefits, which you should be given and going through the full summary of benefits before you even elect to enroll in the plan. So you should have all the plan details before you even enroll into any plan. So that you should automatically know if your plan includes it or not. Okay, let's talk about supplement plans, Medigaps. So that's another word for it, Medigap. And it's exactly what it sounds like. It's meant to fill the holes or cover the gaps between original Medicare and those leftover costs from Part A and Part B. So, that's what it's meant to do. It's meant to supplement or fill the gap. You, generally speaking, must have Part A and Part B to purchase a Medigap policy. And you are able to use any doctor or hospital nationwide that accepts Medicare with a supplement plan. So this is a little bit different than your Advantage plans where as long as a doctor or hospital accepts Medicare, you can go to any doctor or any hospital as long as they accept Medicare and Medicare services. So a lot of people like supplement plans for this reason. They do tend to be more expensive, and that's okay. If you're okay with that, that's fine. There are pros and cons to both. But this is one of the big ones, is that there's really not necessarily a network with a supplement plan other than Medicare. So if the hospital or doctor doesn't take Medicare, the plan won't cover them. So that is a huge advantage for a lot of people, and a lot of the reason why a lot of people like them. Another thing is that they don't include your prescription drug coverage for your Part D like the Advantage plans do. So you will need to purchase a separate additional Part D plan. So that's an additional premium on top of your supplement plan premium, whereas it's included with an Advantage plan. So, just something to keep in mind, that is an additional cost that you will incur in a supplement or a Medigap, is that you'll have to have, each plan will have to be separate that you enroll into. So for example, if you also wanted dental or vision, you would have to enroll into that separately as well. So everything, I like to put it this way, everything with a supplement plan is kind of a la carte. You kind of add things to the plan as you want to go. Whereas with an Advantage plan, they're typically going to include most or all of these things, like your medical, your prescription drug coverage, your dental, your vision. They have some other benefits in them that we could go over. But so those are more of like your all-inclusive type plans, your Advantage plans, and then supplement plans. I like to think of them as kind of like an a la carte. You kind of pick and choose what you want and who you want to have it with, and things like that. So because you can have,
and you just choose between them based on what services you want and which one is more cost efficient at that point.
Yeah, like if you want dental, you can add it if you for a separate premium or whatever, right? And you're going to have a separate prescription drug plan anyway, so that's going to be separate. So And, by the way, you can have your Medicare supplement plan with, I don't know, Blue Cross, and you could have your prescription drug coverage with United Healthcare if that plan is going to be more cost effective for you. So you don't have to have your supplement and your prescription drug coverage with the same company. And again, I always tell people it's very important to review and that's something I didn't mention, review your prescription drug plan and coverage annually, because these plans really do change every year, and their formularies can change, and their premiums and out-of-pocket expenses and things like that. So if you do have a separate prescription drug coverage, it is important to review it annually, just to make sure that you still have the one that's most appropriate for your needs and your situation. Another thing I like to touch on is that Medigap or Medicare supplement plans, they're standardized. So what that means is that they all offer exactly the same benefits, no matter where you live or which insurance company you buy your policy from. Now, I cannot stress this enough. I see so many people all the time that have a certain company and they are married to that company and they don't care what it costs. I am sitting here today to tell you that if you have a Medicare supplement plan and you can find a lower premium, why you would want to pay exorbitantly more for the same thing is beyond me. You're welcome to do it, but they are all exactly the same. So, for example, if you have a Plan F with United Healthcare, it's exactly the same as a Plan F with Blue Cross or Aetna or whoever. There is no difference. The only difference is the premium. So, there are some important things to consider when you're first enrolling about attained age rating and community rating and, the different rating systems that they use for their premium increases. So you can also look at that and how their rate history has gone as far as rate increases go for your supplement plans. So there's a little bit more complexity to that and how it's involved. You may not necessarily want to always choose the lowest premium company if they have a history of, after you get in, raising rates on people. So you don't necessarily want to be teased by a low rate, but at the same time, if a company is less expensive than another and they have good rate stability and good, ratings and stuff like that, there's no reason to be married to a brand name. Whereas, you can get something for that's more cost effective. So getting back into that, so there's talking about the lettered plans that offer additional benefits. You need to compare the benefits of each plan to each other, and the plans are A through N. So supplement plan A through plan N. There's different plans in there that have been discontinued and things like that. Like Plan F, nobody can after a certain year, I think it was 2022 or 21 or something like that, can no longer purchase a Plan F as they're aging into Medicare. So and Plan J is no longer offered. There's a couple other plans that are no longer offered out there. So they can stop offering the plans, but the plans themselves don't change once you have them. So if you got a Plan F, you're always going to have a Plan F. Now, there are some theories and rumors out there that insurance companies are going to start maybe more or less increasing rates on people with Plan F to try to get them to switch to a Plan G, because, and this gets down another rabbit hole, but generally speaking, you can go from a Plan F to a Plan G without medical underwriting. But if you wanted to say go from a G to an F, if you wanted to go up in coverage, they can require medical underwriting to change.
Oh, interesting. Okay.
Yep. And so if you want to go from a plan that has higher benefits to a plan with lower benefits, like an F to a G, a lot of companies do not require, within the same company, they do not require the same the medical underwriting. So like if you have Blue Cross and you wanted to go from an F to a G, they're typically not going to require medical underwriting for that in a lot of cases, because you're going down in coverage, not up. But if you wanted to go from like a G to an F and you were eligible for an F, you can you can do it, but it could be subject to medical underwriting, and they could deny you and just keep you on Plan G. So that is
now, just so I understand, because obviously you just said something that I didn't quite understand, or I haven't heard since I first went through my licensing exam. But I guess the higher the benefits, the earlier they are in the alphabet. Is that what we're saying?
no.
Okay.
No.
I wasn't sure if that was a blanket thing that I just discovered here to help decode this. No, okay. So an F has higher benefits than a G, but that doesn't mean that an H has lower benefits than a G.
Yeah.
I was hoping to find something that would help me make sense of this. No,
in fact,
I read something that wasn't there.
Yeah, you read way too much into this. So
I do that. Can you tell? I'm an analytical. If I can find a pattern.
F was the most. We'll get into this in a second, but there's a chart that you can see of the different supplement plans, and F is the most comprehensive. It has all of the boxes checked.
Okay.
And every other plan has little parts and pieces or things missing from it that aren't checked or that aren't covered.
So everything else is a variation of a theme from F, but F is the granddaddy, has everything in it, and then you can choose whichever mix that you want according to the premiums that you want. I got it. Okay.
Yeah. Mm-hmm. So what you're willing to pay as far as out-of-pocket costs and what you want your coverages to be and things like that. So, but yeah, so we'll see that chart in a second. But yeah, generally speaking, you can go down in coverage within the same company. Going up in coverage, you may be medically underwritten. And if at some point you do, like let's say that you pick a company and they keep raising the rates on you for your supplement plan and you want to switch to another insurance company later, you could be medically underwritten at that point too and be declined by that other insurance company. So it is somewhat important to pick a company with stable rates and that's well known and has a good overall rating when you first enroll. But and how they do their rating class, whether it's attained age rating or group rating or whatever kind of rating that they use. So those things can go into it. So it's not as cut and dry as people like to make it seem. Just I love Blue Cross, so that's all I'm going to get, or I love United Healthcare or whoever. Okay, cool, if that's what you want. But there are more things to consider than just one insurance company, because they're all exactly the same. They all provide exactly the same coverage. They all have exactly the same network, which is Medicare. So again, do a little bit of homework and research and at least some price shopping and see how their different ratings work and things like that, and see what you're comfortable with and what their rate increase history looks like before you get married to a company. Because if you get sick and you can't pass medical underwriting, you may be stuck with that company. So just now you can always go back into a Medicare Advantage plan during annual enrollment period and have a January 1st effective date if you are unable to afford the supplement premium and separate costs associated with that. You are always guaranteed issue into an Advantage plan on January 1 where you can enroll through October 15th and December 7th and then drop your supplement for January 1. But yeah, so that is another option. And to add another layer of confusion to this, there are actually some states that do offer guaranteed issue into a Medicare supplement plan. So no matter what, you always are able to get into a different supplement plan if you chose to leave. That's very state specific. There's only a few states that do it, but it is out there. Or one insurance company might offer it, whereas in a state like a Blue Cross, for example, might have a guaranteed issue, whereas other companies might not offer it, but they're going to charge you nearly twice the premium of what somebody that was healthy would be to get if you wanted to switch plans. So this another little wrench in the road there, but this is yeah.
They can't make it easy for us, can they?
No. Why would the government? What? No.
Yeah.
Let's see. So here's our chart of the supplement plans. So You can see plans A through N, and then the plans that are, not eligible anymore are on the far right there. You got your C and your F. So those plans you can't purchase anymore. They don't even include Plan J in the chart anymore because it's been gone for so long. I don't maybe one or two people in the country have a Plan J, but it actually was the only supplement plan that actually included prescription drug coverage with it. It was kind of wild. So, but yeah, so if you scroll through here, all of these plans are exactly the same. They're whether they're whatever company you have them with, and all of these little check marks are the boxes and the things that they're going to cover. So like you look at a plan G, it's going to be the most comprehensive other than a plan F. And the only thing that the plan G doesn't cover is down there for the Part B deductible. So that's that annual Part B deductible that you have to pay, around $150 or so or whatever it is. So that's the only thing that plan G does not cover. And then you can see
nor does any other plan cover.
Right. The
phased out plans did cover, and obviously that was made as an adjustment on purpose, I'm sure.
Yeah, I mean, and well, we can get into this debate too, but never mind. No,
we're doing good. We're fine.
Yeah, it used to be more of an issue, but anyway, since people that are at this point are ineligible to get a plan up going forward. So anyway, there are actually high deductible plans you can get in some states for Plan F and Plan G, so that will keep your premium down. Of course, so if you don't go to the doctor or the hospital a lot and you want to, save some money on your premiums and maybe you feel like you're really healthy, you could look at getting a high deductible Plan F or Plan G if it's available for you. But again, keep in mind that if you want later down the road, if you want to increase your coverage, you could be medically underwritten. So if you wanted to go from a high deductible F or G to a regular F or G, there could be some issues with that. So if you start experiencing some out-of-pocket expenses and, you start having issues with that. So it is an option, and the premiums are typically a lot lower because of, the deductibles. But it is just something to keep in mind that that is an issue. And I believe that if I'm not wrong, I'd have to double check on this, but I believe the deductibles can change and go up on them as well. So I may be wrong. I'd have to check on that, but I think that they can. And not a lot of people have a Plan K or a Plan L, but they'll show how much they approve for services before you meet your yearly limit and Part B deductible. But then once you've met those and your yearly out-of-pocket limit, the plan pays 100%. I don't think I've ever sold a Plan K or a Plan L. I've never had anybody even ask me about one. It's just something to be aware of. So Plan N is an interesting plan, and certainly in states where they don't have excess charges, so Medicare Part B excess charges, these can be really interesting plans because you don't have to worry about the excess charges. And it works very similar to a Plan G then, and the premium is typically a lot lower. So if you live in a state where excess charges are illegal, a Plan N can be a pretty good alternative to a Plan G and save you some money. They do have a small copay for a doctor office visit. I believe it's like up to $20 or $25 or something like that. You have to pay to go to the doctor. But I mean, the amount of premium that you'll save over Plan G to pay 2 copays a year, it's well worth it, or whatever it is. So, and then if you visit the emergency room and you're not admitted, you may have to pay a copay for that as well. But it's a minimal copay, somewhere around $50, I think it was. But yeah, 50 to 75, not a big deal. So let's talk about some enrollment periods. A lot of people get these things confused, and we'll kind of go over this a little bit and how it works. But generally, you have your IEP, or initial enrollment period, your GEP, or your general enrollment period, your SEP, which is a special enrollment period, and your AEP, which is annual enrollment period, and then the Medicare Advantage Plan open enrollment period, MAPD. Yeah. So, oops. Okay. So your initial enrollment period basically is only applicable if you're turning 65 or you're newly eligible to Medicare, and it enables you to enroll in Medicare and choose a plan. Can you scroll down a little bit? I think there's more to this. There you go.
Oh, okay. We got 3 columns or 3 rows, whatever.
Yeah. So, and this is 3 months before your 65th birthday through 3 months after. So you have 3 months before the month of and 3 months after your 65th birthday to enroll in Medicare. That is how that works. And then during that time, you will have, no matter what your health status is, you will have guaranteed issue in any plan that you want. So any kind of advantage or supplement plan you so desire, you can prescription drug plan, you can pick at that time. You have guaranteed issue. And so this is kind of the time to make those decisions and figure out which way you want to go. So that this is when a lot of people first start getting their Medicare and U book for the first time, and they look at this telephone book size thing and get scared and confused, and that's where somebody like myself or another local person that helps with these things can help you with. But there is an important point I want to make about this, though, is that anybody that represents themselves as a Medicare expert or a Medicare specialist or a Medicare whatever, anything that implies that they're endorsed by Medicare or CMS is very illegal. And there's actually a law about this, and you can report them to CMS, and there can be a lot of severe consequences for it. But so just be careful. Anybody that comes across saying that they're a Medicare specialist, expert, representative, anything like that, that is highly illegal. You can't market yourself that way. And there's rules and regulations around that.
So you're saying that insurance agents cannot say, I'm from the government and I'm here to help?
No, unfortunately they cannot. Yeah.
I'm just saying.
It's wild, right? Anything that implies that you're endorsed or sponsored by Medicare or CMS, or that would even give that implication, is a very big no-no. And unfortunately, I see a lot of agents kind of teetering on that line, and it's just something to be aware of, especially as an agent. You don't want to lose your license or not, lose your contract or whatever. Just to say you're whatever on your business card or something stupid. I mean, come on, let's get real here. Don't risk your income for something stupid like that. All right. So now we have general. Go back up. We're not done here.
We're not done here. Okay, sorry.
Yeah. So next we have. I know we're going a little long. I'll go through these quicker. So now we have the general enrollment period, and that's if you missed your IEP and you want to enroll in Medicare Part A or Part B. And this happens January 1st through March 31st, and you're able to enroll in Medicare, and you're very limited as to what you can do. You can basically enroll in Medicare and pick up a Part D plan. It's pretty much all you can do. And then we have a special enrollment period, or an SEP. Now, some people call this a special election period, whatever. So this would be like when you had your previous employer-based coverage, you're turning 65, you're retiring, you're losing that plan, and you're enrolling in Medicare Part A or Part B, you're leaving that group coverage, and now you have 8 months from that to pick coverage, whatever plan you're going to have. So that is one thing, and you do again have guaranteed issue into whatever plan you want. So that is an SEP. It's an SEP EGHP, which is basically a loss of employer group health plan. So that's the code for it. But anyway, and then AEP is what everybody's familiar with, annual enrollment period. So you're already enrolled in Medicare. You want to reevaluate your plan and make changes. And that's from October 15th through December 7th of every year. And this only applies to Medicare Advantage and Medicare prescription drug plans. You can actually change your Medicare supplement plan every single month if you want to. It is subject to medical underwriting, though. There is no enrollment period for Medicare supplement plans. This only applies to Advantage and prescription drug plans. So that is all that AEP applies to. A lot of people think that that I've ran into think that they're stuck with their supplement plan until AAP, and that's just not true. You can change it every month if you want to. I don't think I'd recommend that, but you can.
Drive your agent crazy.
Yeah, right. I mean, well, that's okay. And then, I don't want to have to. If you're gonna do that, do it. Go find another agent. Let's put it that way.
There you
go. Yeah, and then you can, if you enrolled in an Advantage plan and you want to make a one-time change to your plan, you can do that from January 1st to March 31st. You can only basically drop your plan and go back to your other plan or go back to original Medicare. There's not a lot of flexibility. Some people will try to use this to like abuse the system and try to get out of the Advantage plan that they enrolled in if they don't like it, or their Part D plan. They try to game the system a little bit, but in reality, you can make a one-time change to your plan. It's a little technicality, so I typically just let's put you in the right plan in the first place and not worry about this, right? So that's where I go with that, but it is there. So this is a very high-level overview that we just spent an hour talking about. I could go into a lot more detail about a lot of these things. So, yeah.
Oh, there we go. We're at the end. Okay.
Yeah, we're at the end. Again, I'm not in any way endorsed by CMS or Medicare. I'm not making recommendations for anything on this and what to enroll in. If you want to actually, set up an appointment and talk to me, you can. You can always email me and set up an appointment with me. And we can go more into detail about this stuff, but yeah, there's a lot more you could actually go into for these things. So this is a very surface level overview that provided, hopefully, a little bit more detail than you would typically see in a lot of these marketing materials that just talk about Part A being hospital coverage, Part B being doctor coverage, stuff like that. So hopefully this at least provided a little bit more insight into some of the inner workings of these things. So,
yeah, I want to first of all say good information. I mean, really good information. If you're in the hunt for Medicare and you're about to turn 65, I think those that find us out there on the airways and the social media channels, that this is a very good presentation of the things that you need to know and how you need to go about maybe searching a plan or finding what's best for you. But a couple of questions I got for you, Mike, is we're all advocates for our clients and whatever aspect of business that we're looking at placing with them or helping them and educating them. What if you're let's say it's it's January of 2025 already, and I'm going to be shopping for a plan this year. When should I start looking at the things that maybe my medications or what plan may or may not fit me? When should I start making that that search?
Yeah, I mean, the sooner the better, right? So if you're starting to think about it, you can always get plan information about all the different plans for the current year. We actually can't disclose any 2025 plan information for specific plans yet because AEP hasn't started. So as far as looking into the future for 2025, the plans are out there, their certifications are ready. They're kind of getting everything set up for AEP, but we're not able to discuss them until basically after October 1st, and then we can start enrolling people October 15th. So you really can't disclose any plan information until after October 1st, and then people can start making decisions October 15th through December 7th. But I would say, as soon as you can, if you're thinking about retiring, or you want to start looking at getting some kind of Medicare, take that time to research plans and see what you like and, do the stuff. But typically, again, you have that 313, that 3 months before the month of and 3 months from your 65th birthday or whenever you get Medicare that you can enroll in a plan. So I start a couple months before that and start looking at a plan, and that way you'll already have the information hopefully that you need, and you can make an informed decision. But yeah, I mean, I don't think there's necessarily a bad time. Now, if you're like 2 or 3 years away, I mean, things are going to be totally different then. But if you're within 4 or 5 months, maybe, or 6 months of looking at retiring and getting Medicare, yeah, for sure.
The other thing, I just wanted to mention for those that are kind of, local to me and that are catching this maybe somewhere, in the next few days or whenever. Mike's actually looking at coming down here in the Middle Tennessee area with me during the open enrollment period this year, first part of October. And, I know him and he's very, very well versed in this topic, as you can tell for those that find us out there. So if that's of interest to anyone in my local area, I'm gonna look at having him down here in person to answer any of your questions and to help you make maybe a better informed decision than what you may have had in the past if you're hesitant about what you may or may not need. So just be looking for that.
Yeah.
But Mike, you're not just local. You've got licenses in many states, not necessarily all the states, but I don't know, 10, 12 states. I don't know. You have a bunch of licenses out there.
I mean, something like that. I probably have about 10 or 12 right now. If I don't have the license and you want to work with me, let me know. And depending on things that, I can probably get the license and get things going in your state. So there's just a small cost associated with that for the state licensing fee. It's no problem. But, yeah, so anybody that
let's just clarify that cost is on Mike. That cost is not on the consumer.
No, it's on the consumer. I'm making them pay. Just kidding.
Okay. I'd like to see that invoice. Okay, but
right? No, I'll pay for the license. Yeah, so that's no problem. But I used to actually be licensed in 35 states when I was doing this. More on a consistent basis. But yeah, I've been licensed in multiple states. Like you said, I probably have about 10 to 12 right now, but getting more is not a problem. So even if you just have questions, I may or may not be able to answer them generically, even if I can't talk about a plan in your specific area because I'm not contracted with them. Yeah, anybody can reach out for sure.
Yeah, there's this email. I've been showing that email address off and on here throughout, and of course, it's been scrolling there. And our very long disclaimer, just to make sure that we're compliant on all this stuff. But yeah, reach out to Mike, and Mike will treat you right. You can tell he knows the stuff. He's going to help guide you right to help you make the best decisions possible. Obviously, this is still an overwhelming topic. I know a whole lot of stuff. This stuff is still Greek to me. So you got to get someone who knows the stuff in and out and cold, and that's why I don't want to do it. Mike, you're my guy. You're going to be the guy that does all this stuff. I don't want to touch it. I know it just enough to say, talk to someone else. So no, Mike, I appreciate that. This is very well thought out. This is enough to get some information. And we want to get this video out to people like Kurt. You got to send this out to all of your client list that's out in your area. Make sure that they've got this, especially well in advance of open enrollment period. So I look forward to seeing how this works out for everybody.
I do.
I think.
Yeah. Just I so that booklet that I went through was kind of my basics booklet. That was the very basics. Keep that in mind. What we just talked about was the basics. Now I do also have an expanded edition of that people can request if they want. I give these out for free, so there's no charge. So I'll just email you a copy of it. Okay. I'm not like these guys that want to charge, $20 or whatever for their little PDF. Forget that. I'll just send it to you. It's free information, but it tries to lay this stuff out in a simple, easy to understand, manner. It goes through it, A, B, C, D. It tries to list things out. But I do have an expanded one that goes way more in depth and covers everything. And that one I think is at least 50 pages. So maybe closer to 100. I can't remember, but.
So be careful what you ask for. You just might get it, right? That what you're trying to say?
Yeah. So it's one of those things where it's great to have. How much you'll actually use it, I don't know. But it could also be, great reading material if you can't sleep at night too. So
I could have used that last night. Okay. So anyway, with that, ladies and gentlemen, thank you so much for tuning in, watching, and listening. Reach out to Mike if you have questions on this stuff, especially because we're coming up on open enrollment period. We'll leave it at that. Thanks so much, and we'll catch you next week. We are on for next week. The week after, I'm doing a whole virtual summit for the insurance industry, for the professional association. So we won't be doing it in the week after, but next week we're going to have a really interesting topic. We're going to confirm the details, and that one should be a lot of fun. So we'll catch you next time. So, thanks so much.